Welcome to The Remedy, brought to you by NYC Health Hospitals, innovating public health care to benefit all New Yorkers.
Hey everyone, it's Michael Shen, and welcome back to The Remedy from NYC Health Hospitals. Today we're talking about art. A lot of people don't know that our hospital system maintains one of the largest non-museum public art collections in the nation. And we actually have a system-wide arts and medicine strategy to support our workforce, as well as our patients, their families, and their caregivers. Through visual art, music, storytelling, performance, and community collaboration, our arts and medicine department brings humanity, joy, and connection into healthcare spaces across the city. So joining me today to talk about the history and impact of arts and medicine are Larissa Trinder, Assistant Vice President of NYC Health Hospitals Arts and Medicine, and Mickalene Thomas, a renowned Brooklyn-based artist known for her striking portrayals of Black women that explore themes of identity, race, and gender. Mickalene recently unveiled a large-scale mosaic on view in the lobby of our newly renovated Ruth Bader Ginsburg Hospital in South Brooklyn. Larissa, Mickalene, welcome to the show.
Thank you.
Thank you.
Yeah, it's been a long time coming. I've wanted to do this show for such a long time about all the great arts programming that we do in our system. I wanted to just start off, Larissa, with how do you define arts and medicine, and why is it important in hospitals?
Yeah, that's a loaded question and a very important one. And thank you so much for giving me the opportunity to talk a little bit about this department and our strategy here at New York City Health Hospitals. But the department really was formed pretty strategically in 2018. And it really oversees, as you mentioned, a collection that's pretty historic, dating back to the 1930s, includes close to 8,000 works. And we equitably distribute those works throughout the health system. We curate them in different kinds of spaces. So the kinds of works that go into a pride clinic are different than the kinds of work that go into a women's health clinic and into a pediatric oncology space. So we really think about how the works we have can actually create environments that help with healing, that help with distraction. And the other kind of component of what we do is bringing in evidence-based programming with cultural partners and nonprofits in the city to address staff burnout. So I think that the couple of singularities about this is, number one, we're a department within the hospital system. And number two, we are really looking at how to address burnout and make sure that our staff, our 47,000 employees, really feel cherished and valued because we believe that that correlates with better patient care.
You know, I always want to point out that, like, as a department, you're actually situated under quality, which I think is really a statement about, like, the values of our hospital system in a way. And you mentioned, you know, how many works of art, you said 8,000 works of art. It's really one of the largest collections. And we're a public hospital system. You know, at Woodhull, where I work, in our lobby, we have a Keith Haring mural. Really, I don't know if you've seen it or if you've been there. One of his public works that's just like kind of secretly located in a public space. But it's really beautiful. And there's works like that all over our system. One thing I wanted to ask you, Larissa, is how does a health system, what's it like for a health system to kind of manage such a large collection?
Well, a couple things about the collection. It's a big undertaking. There wasn't always sort of a department like this one that was stewarding it. This collection is owned by the people of New York City. And, you know, we are really very proud of it. And also it's a kind of a hidden gem because people were not aware, nor did they think that a public hospital system would have such an incredible collection. A lot of other more affluent hospital systems tout these incredible collections, but we are, we're just really fortunate to have it. And it's really about health equity in many ways for us and making sure that our patients and families feel very valued. But you mentioned the Keith Haring mural, and that in particular was sort of interesting because he did that mural in 1986. He was at the hospital for 2 weeks, engaging staff and patients and really understanding, and there's HIV clinic there and some work in that space that sort of addresses a lot of the things that he did, that he was an activist about as well. And then he later, of course, died in the early 90s. And so when I think about these artists and large-scale experiences and how they really help to reflect the communities in which they're installed and create a sense of trust in systems, which is also something that people have trouble with, historically marginalized communities in particular. I really think it's important to make sure that we continue to bring through those voices. So when we had the opportunity through a nonprofit named RX Art to work with an artist like Mickalene Thomas, we all just were absolutely so excited about this. And, I'll let her share a little bit more about her experience at South Brooklyn Health. But that large immersive space continued for us, this long history of and legacy for this collection.
So you mentioned kind of like Keith Haring being there and painting. There's actually really great images online of him on like scaffolding,
yeah.
painting it.
Yeah.
And there's
I
actually
think I've
also
seen those.
Yeah,
Sure.
seen those?
I just
Yeah.
haven't seen the mural, but
Yeah.
I've seen those.
What was it like for you painting or creating that work of art?
Oh my gosh, when I've always, thanks for having me here, and always a big thank you to Larissa for including me in sort of this discourse of conversation. I think for me, I'm always excited about doing public art. I think public art is one of the most accessible art forms because it has no barriers for who can access it. So it's like one of the sort of aspects of my practice that I could really engage with the community. So when RX called, working with Diane Brown, of the organizer and founder of RX Art, when she called and said, hey, we have a location for you and we want to do this project with you, it was like unquestionable for me that I would say yes. Mainly because the location, who was for Ruth Bader Ginsburg, sort of that inspiration and really looking into some of things that she loves, some of her favorite flowers, freesia. And so really wanted to really bring something to the community and also to that space that felt like a longing of outside, of sort of a space of looking forward, of spirituality, of just energy. But for me, doing these type of projects brings more of awareness, not only to some of the social practices that I'm interested in, but also just to my own work and just building community. So these platforms are really fantastic. I think I love hearing what Larissa was talking about, how that the art is particularly in the New York City Health and Hospitals owned by the New Yorkers. How can we make that more accessible for people who don't go to the hospitals? Is there ways where this collection could be sort of viewed sort of like a mapping system or something where it can really sort of speaks to New Yorker? Because I don't really think a lot of people know the importance of how this art is in these hospitals. You know what I mean? I didn't know that until I got involved. And so I'm learning more and more about what you guys do and how fantastic it is. And just like, I'm like always blown away. And I'm like, wow, there's more to it than just inviting artists to put things on the wall. So it'd be really fantastic to sort of try to expand that to really, maybe it's not about always going to the Met or MoMA, but perhaps there's like a day, or a day in 1 month where it's just like New York City Health and Hospitals that's open to the public.
Well, there's a couple of ways we have thought about this. We're on the Bloomberg Connects app, and we do have some works up on our website, but I think that's a really incredibly good point. And this entire mission of New York City Health and Hospitals is about sort of access and opportunity and equity. And, this collection, a lot of these pieces like Mickalene's are in very large public spaces. Some are in more private spaces and patient areas that nobody can ever see, which is why those ones are really important to get on Bloomberg. But connects. But, I think, we do have a lot of academic institutions and public schools in New York City that are interested in this and that want to come and see your work and the Keith Haring piece and some of these other more publicly facing ones. And so we have kind of upped our strategy around signage and making sure that all sorts of, populations are included in having access to this. And I do think that that's extremely important. We're in the process now of moving in very significant work by Romer Bearden that was done in the 70s from an upstairs space at Bellevue Hospital to a much more public space in the downstairs. It's wonderful. And his work, and Mickalene could probably speak more about him than I could, but he, had a nervous breakdown in the 50s, was admitted to Bellevue Psychiatric, and then sort of, informed a little bit more of his collaging after that. And this particular work called Cityscape is extraordinary.
It's one of his most notables, for sure. Yeah. So to have that is just like really unprecedented. Another thing I did not know. So But so not only is Health and Hospitals a huge collection, there are historians about really educating people about the art and like the history. And also just that also speaks to the vulnerability of artists, right? You mentioned two artists that had to go to the hospitals, one for their healthcare, both for their healthcare in different reasons, mentally and physically, right? And so that's often a real big case for artists in my community of like, so knowing this support of just like having that outlet and knowing that there's art there is another, art is healing. Art is about healing. So having that immersed in the hospitals is a really valuable aspect. And I think
Essential. I always say like the art is a piece of hospital equipment. It is put to work to help you heal.
Talk about that more. I know you mentioned also kind of an evidence basis for this. I'm a doctor. Obviously, I care about evidence,
Some
but
of my art.
yeah, exactly. And I hate kind of going back to evidence because I'm kind of like art. I don't need evidence that art works, to heal.
I think historically, the body of evidence around art, visual art, and performative art in general has had really more of a qualitative kind of, body of research. And there now is a ton of quantitative as well. And we're continuing in arts and medicine to kind of build that body of research. And we do that in a myriad of ways. And it's sort of interesting with the visual collection, like Mickalene's, thinking about how that space is now activated and how, as I said, it addresses things like, does it enhance trust in a system? Does it enhance a sense of belonging? And we recently did a global study with the World Health Organization called HOME, Hospital Mural Evaluation, and it was Nigeria, Slovenia, the UK, and us with a large-scale mural. In our case, it was one from our community mural project by a wonderful artist named Ebony Bolt. And, what we kind of are learning, it'll be published in a few months, is that the staff experience and the patient experience actually were different, but equally so in the sense that they found great value and trust in it. So I feel like artists have an absolute and integral role in our healthcare. And if we are not offering art as an opportunity, we're not actually doing everything we can as a holistic approach to healthcare.
No, I would agree to that. And I think art has an integral role to our cultural healthcare as well, right? And oftentimes what I find as an artist when I'm invited to collaborate, whether it's brands or corporations, it's an afterthought, right? How could we really integrate it into a fabric of understanding that's quantitative, right? That is a part of the beginning process. So when these hospitals are being built, when they're being thought of, they're not thinking of just as they're thinking of spaces and stuff like whether it's for the clinical spaces of, for the GYN or whatever, or pediatric, they're really considering the art as well, right? When you're thinking about the machines that are going in and how they're going to be sort of placed, we should be really considering how the art is going to be integrated.
100%. And I think that we're building off of some sort of archaic intentional design principles that say like,
it's the same for architecture. It's everything. It's an afterthought. The spaces, urban places, are an afterthought for art. Then we're like trying to squeeze like this monumental sculpture and a little garden space that we know don't fit, right? Without thinking about like, okay, we would love sculpture here. This is a sculpture garden. What does that do to the environment, to the community, how people move, right? All of that makes a difference.
in their experience. And I will give Health and Hospitals an incredibly big compliment here. Working here is such an honor that I feel there is a definite more deeply rooted kind of culture around thinking through those kinds of things. And so now we work our arts and medicine department with the facilities and design teams, and they're getting better and better and better, frankly, about saying, hey, we are now, about to, we're doing a major project in North Central Bronx that would be interesting to you over a 1973 ceramic work by Helen Frankenthaler that's extraordinary, that was commissioned by her for this space. And the complexities in exhuming this kind of fragile ceramic that's pretty large is very fastidious. And so, the facilities team there are amazing, and the staff at there are incredible, and the Frankenthaler Foundation. And so we really are bringing together a lot of thought to make sure that these murals last forever and continue to tell stories. And we're continuing to be able to bring in the voices of new generations and accessions into the collection so that it isn't just stop at 1986,
I really do agree with, I wish that a lot of these buildings and the clinic spaces were built with art in mind, or like with that, they're built for utility, right? They're built for clinical utility, but I would argue that the aesthetics and the art and the design is also of great utility for people feeling comfortable, feeling welcome. And I do wish that, a lot of places were thought about that a lot.
I think a lot of art is not considered when it comes to any space, right? Even visual art today is still looked at as sort of an art form that is not equitable for many, right? And so you don't necessarily think that you're proud to have your child go to school to become an artist. You rather them become a doctor or a lawyer. My parents wanted me to be a lawyer because that was sort of a route of security, right? So we don't really think about it's kind of in our DNA when we think of it is a creative field, and we know that it does something for us, as far as healing, but we really don't really put all of the effort and support financial resources behind it to make it part of our sort of daily lives, education within the sciences, through sort of the sort of myriad of spaces that need to sort of like look at art as a sort of a form of healing throughout.
She just talked about funding, and I think that's an incredibly important piece here because this department is primarily funded by the Loriam Tisch Illumination Fund, and we've recently got some wonderful support from Bloomberg Philanthropies. But the hope and the reality is that in order to sustain a department like this, we cannot rely consistently on philanthropy. It's really something that needs to be proven as an essential service line and component embedded in hospital systems. And there is a lot of economic benefit to this that I've done a deep dive into, thinking about retention rates and other ways that we are contributing to that. And so, it actually will, in the long term, not just health and hospitals, but the healthcare in general in the world, save money if you're integrating art and doing these things.
When I reached out to your team to request art for our primary care clinic, and once it came, our staff were really, really happy with the results. I think having that beautify the space also just validates, the place where you work, that your work is important. So I just want to say also that is completely true.
But also engaging with the artists, right? I think like what you're telling me you're doing with Jamal Robinson, how he's engaging. He's an artist who's going to be doing a mural. I'm not sure I'm supposed to speak.
It's okay, in Harlem.
In Harlem. And so Larissa was just telling me about some of the sort of involvement and how he's immersive in working with some of the people that work there. And I think it's really sort of fully engaging with the artist. So it's not a decorative element that's just on the wall. And oftentimes that's what it's considered as, oh, let me put this picture here next to this couch, right? And that's not what we're doing here, right? We're really, really changing lives and understanding that art and medicine are simultaneous. They're equally important.
There's a very fun, the community mural program is kind of co-designed in exactly what she said. It's the entire kind of infrastructure for that is the artist in engaging with the staff, engaging with the teams, and, the artist sort of hearing that feedback and then in their medium or, in their skill set, putting together whatever that is that reflects that. So that representation is so important.
I wanted to go back to your work, which is titled Freesia on My Mind, The Beauty of Ruth Bader Ginsburg. When you were first invited to create this work, what was on your mind? How did you decide what the subject matter would be? What was your process?
I think when I was invited to participate and when they told me that it was about Ruth Bader Ginsburg, I was thinking about my daughter, really. I was thinking about her fascination with Ruth Bader Ginsburg when she was about 6 years old. And when she was at school and she was talking about Ruth Bader Ginsburg to her students, and she's like so upset they didn't know who she was, right? And she came home, she's like so upset. She's like, Mom, no one knows who Ruth Bader Ginsburg is. I was like, are you kidding me? She's like, no, they don't know. And so and she was doing these flowers, right? And we didn't know at the time that Ruth Bader Ginsburg had her favorite flower of freesias. But she was doing these flowers and she called them her Ruth Bader Ginsburg flower, right? And so I knew immediately that I wanted to do something that had a particular child's play to it, but I also wanted to do something about the landscape and flowers that connected me back to my daughter and her experience with Ruth Bader Ginsburg, but also just to celebrate who she is. incredibly incomparable in its spirit. Like thinking about the spirit of the person, right? The spirit of the person has to be so spiritually tapped into who they are to want to position themselves in situations and have great foresight of the world, to want to be such a pillar, right? And constantly steadfast to fight through and provide sort of space for others, as Ruth Bader Ginsburg said. And so when I think about space for others, I think about the expansiveness of space and about what that can be afforded. And oftentimes, the state of rest is something that's not afforded. When we think about the state of rest, we don't think about the state of rest for particular bodies, specific bodies of color, of resting. That's a form of luxury to sort of just be in the state of your own self-care, right? And when I think of self-care, I think of the landscape. For me, that sort of expansive space of being able to see, to appreciate a moment of flowers, right? To appreciate that on your day is a form that is not afforded to everyone. So I wanted to provide that in a space for those who, that may be the only moment that they have a sense of a landscape, right? That's completely different from the outside their window, whether it's their home or their hospital window, that they can have this sense of this field of flowers or sky, and just they can be transformed. So it's about the transformative transition of life and what that means. Flowers to me is something that's analogous to a hospital, right? It's care. It's the one thing that we always bring to someone, right?
Yeah.
And so I really wanted to make those connections.
But anybody also who knows Mickalene's work, and she's thinking of these gorgeous African American women laying in beds of flowers and doing things of leisure. And you're right, you're really lifting up there.
And so I wanted to remove the body and allow the body to be sort of present by the person that's coming in a hospital, by the patients, by the workers, right? This is their landscape. This is their field of flowers.
And you talked to Ruth Bader Ginsburg's granddaughter.
Yes, I spoke to Ruth Bader Ginsburg's granddaughter, and she told me about her favorite flowers, so that's why I put the freesias in them. It was very important for me when I think of portraiture. I'm really interested in signifiers that represent the person, because I believe that whether there's objects of ideas, signifiers, can really tell you about who a person is. Your pair of shoes, right? The chair you sat in, right? A lot of my art stems from that when I create these immersive homes. The furnitures that I recreate in my spaces come from me experiencing and seeing as a kid my grandmother sitting in this chair in our house all the time. And what I was so fascinated by this chair was the imprint and the wear of it when she got up. Like where I knew exactly how she positioned her elbow, right? From the wearing of that.
Yeah, I feel like I can see it in my head.
Yeah, me too.
Yeah, or where she held her hand.
Yeah.
From the sweat and oils of that
And
on
you
the
felt
edges.
the love.
And so when she would get up from that chair, my grandmother for me was still there by all of those other elements, right? That residue, right? So for me, portraiture is so much more than sort of this dimension of who we are right here. It's all of those things that we sort of bring into our lives, that we do the wear and tear, that we engage with, and that we love.
And, for anybody who hasn't seen the work, I really encourage you to look it up online, or even better, go to the lobby of South Brooklyn Health.
And also right now, there's a huge billboard on the High Line you can see of my work.
Oh, really?
On 8th and 10th.
Okay.
18th
All right.
and 10th.
Noted.
Yeah.
I'll take a walk that way. But this work is quite big. It's 76 feet by 8 feet.
Yeah.
And I know that for those of our listeners who don't know, you work a lot with different materials, rhinestones and acrylic, enamel. What was the process of building this piece?
Process of building this piece was really important for me that it was permanent, right? I've done several murals. I think this is probably my 15th mural, 15th public art mural, mosaic. And I often find that when I do painted murals, I think, first of all, they're much more costly because you have to repaint them. The light sort of exposure deteriorates the color. And so there's a lot more upkeep, right? When you do a painted mural versus something that's very permanent, like a mosaic. So for me, and mosaics also are much more relatable to the materials that I use in my studio. I like the fragment of the mosaics. I like the color. I like the different materials of the glass versus the transparent and opaque. Whether they're the subway tiles, and so you can do printed tiles. You can actually do the smelty, like sort of.
It's impervious to lots of different kinds of substances in the hospital, so it actually is a really
and it works well with sort of the substance hospitals. And historically, is traditionally the material that's used when you think of murals. And so I love that tradition, and I want to just keep to that. And also, if you're going to, I think, we talked about expense and resources. If there's going to be this investment to have real art on the wall, then have real art on the wall, right? And have it be permanent, right? So that many people can see for a long period of time. Because oftentimes when there's a painted mural, it's easily to replace it.
Yeah.
It's easy to get painted over. Many murals of artists have gotten even tear down or
WPA murals.
Yeah. So for me, I always think about sort of the longevity of the work when I'm making. I think about the longevity of my own work and the archival nature of it as well.
I'm going to put a lot into this question, so bear with me. So I know that you were pursuing a law degree when you first became an artist. And I also wonder, like, in a healing environment like a hospital, did those aspects of working on this mural, did it change your relationship to working on this mural in particular, given that it was RBG?
It changed my relationship on how I want my work to be seen, for sure, more so. Like more in a more vigorous way. I'm really much more interested and excited about more public spaces and how that could just really allow my work be more accessible. I mean, I haven't really thought about it that much until I'm invited, right? And so now I'm actually pursuing them more. Like
You have an open invitation.
Yeah, so before I often wait until I'm invited to do a public art, but right now I'm actively pursuing these projects, by applying for them, and just because I think it's really a valuable thing to not always have your art be of sell, right? It should be sort of a gift to the world. And I wanted to go back to sort of like me deciding to be a artist versus a lawyer. It came actually about in a healing space through art therapy, right? So I was taking an art therapy course, and that's how I decided that I wanted to become an artist. So, art therapy, that form of healing really allowed me to really reconsider my own path, and then I saw Carrie Mae Weems' work at Portland Art Museum and all of that. And so it's really kind of put me on this trajectory. I think it's really important for artists, and I think it's important for institutions and organizations like New York's City Health and Hospitals to continue to open up to a diversity of artists, emergent and very successful, so that dialogue and discourse is very much sort of a space that people can really understand that we are all different fields, and that art is just, it's a crucial, we're at a crucial point too, even more, I think, to really embrace art, and teach the value of that.
Well, I always say, artists can kind of get away with things that
Sometimes.
us other people cannot. And, that's sort of why I feel like the arts and medicine department's a little bit of an aperture for these kinds of conversations to raise and lift up some of the resources that we have. So we just recently did the Hospital Violence Interruption Program mural with all 5 sites and this one kind of comprehensive mural that now kind of will sit and sort of describe, what these important initiative is in the hospital. But also NYC Care we did a wonderful partnership with 3 of our artists that are immigrant artists that really were able to kind of lift up that resource for our immigrant community. So, thinking about the mission of this hospital, which is to me an unbelievably powerful one in that it sort of does not turn anybody away regardless of circumstance, and the obligation from an arts and medicine and artist perspective to lift up those communities is really part of our ethos and part of what makes us special. And, I think that when you think about the arts, I often say, like, as I said earlier, if we are not thinking of all of the things in this life that bring us joy and happiness, our health is not just the absence of disease. It is the things that kind of every single day, whether it's music or art. So everyone at South Brooklyn Health who walk by that mosaic every day, are getting something beautiful put in there, maybe the only beautiful thing they see all day. So it's really, to me, artists are, again, really an essential part of our workforce. And
I also love the testimonies too.
testimonies are
I know
wonderful.
the testimonies are just so great.
People get emotional.
I know every time I read them, it just really puts a huge smile on my face to go, okay, this is what it's about, right? From that little kid who just like beams, right? Or that doctor who walks through because they just came out of an intense surgery, right? And they're just like, okay, yes. It's that breath, right?
Yeah.
To just sort of those various testimonies that are so varied that really changes lives. And it's not just about the people who are patients. It's about everyone, right? That's
why measuring it, as I said, between qualitative and quantitative is so complex, because while the world needs sort of this economic, cost-benefit analysis of what this is doing, and so that's what we're working on, and we can do that, the real beauty comes from these testimonials, as Mickalene's saying, and sort of the actual lived experience.
I really love our conversation around public art in particular. And I think, I hate this kind of like idea that like we need to cost benefit analysis, like, art and everything. But there are very practical kind of like also reasons for public works. And so it also takes us back to our history, which you kind of mentioned before, starting with the Works Progress Administration. And how that art came into our system. Can you tell us a little bit about that?
So the Work Progress Administration was an initiative in the 1930s during the Great Depression by Franklin Delano Roosevelt, our president at the time, that really sort of thought about the way that artists could actually be engaged and hired and paid at a very difficult time in our history. But also just, how can we beautify these public spaces? So at that time, all of these murals came into our system, a lot of them inspired by, obviously, Diego Rivera and other very notable artists, but they went all over the country. And this hospital system received the most institutions, schools, post offices, and all of these things. And, these are incredible storytellers of the past. And so we happen to have 13 came into the system. I won't dice it all up for you now, but we really, and I think it includes 89 or 86 panels all in, so it's quite extraordinary. And they're in many of our facilities. I think most notable, Harlem Hospital has Vertus Hayes and Charles Alston and Georgette Seabrook, really spectacular in their mural pavilion demonstration of this really amazing exhibition that we're about to have at the Museum of the City of New York in June through September. Is with 16 panels by an artist named Abram Champenier that were initially created for a children's ward at Gouverneur Hospital. And they're all of Alice and Alice in Wonderland doing all sorts of things. And I can't wait for Mickalene to see them, because they're so imaginative, because it's what would Alice do if she had a day in New York City. It's amazing. And she's squishing her friends on the subway. And so we're going to have a lot more around that with programming and engagement with our staff here. But those were very early exemplars. And some of these children were in long-term tuberculosis. So that fact that they had these beautiful immersive experiences around them, where there was no research at the time, but that was actually helping the nurses and the staff as well as the patients kind of get through that time.
What do you think our patients and community of modern day will think when they see these murals of Alice in Wonderland from so long ago?
That's rad.
They're going to be like they are, and that's what I think.
Yeah, this should have happened a long time ago.
It should have happened a long time ago, and they're so just whimsical and fun, and I can't say enough about them. But yeah, I mean, I think there's going to be a lot of astonishment. They have not been brought together in this way since the 1930s, and there's a whole rescue story that kind of occurred. But it's just it's really important that we continue that arc, and that's why this Frisia on My Mind was so a part of that story now, and a part of the legacy and the history. And I do think there is kind of a challenge for us with some of the community murals that are not in mosaic, and we do have to touch them up and make sure that they are protected and have longevity. But the reality is, to your point, Mickalene, like many, they do fade and they do require work. So I think integrating more impervious materials like mosaic and other things really could be an important strategy for us, in the future.
Speaking of legacies, Mickalene, I also know that your work often touches on the idea of like rewriting certain legacies, like Les Deux Juniors, like re-envisioning paintings of old in new light and with new, visages. How does it feel to be part of this legacy for our public hospital system?
I approach it the same way of reframing the narrative and reframing notions of how people see themselves, and I think for me, I'm really excited because I know the materials that I use, my daughter hasn't seen it yet. I want to actually take her to see it and her friends. But what does it look like 10, 20, 100 years from now, So knowing that I'm a part of that legacy about RBG and the hospitals and New York City Health and Hospitals, I think for me it's fantastic. It's fantastic to be a part of the sort of this legacy and an ongoing mission, the vision and mission that they have, and to be selected. It's an honor, so much gratitude around it. Because I'm constantly learning, and for me, I'm always love the fact of being a student because this was a space that I knew about through RX art, but adjacent, right? So, but being really fully in it and immersed, I'm just learning so much more about sort of the endeavors and sort of the importance of it, right? To such a great level. So I speak about it. And so I also share my friends and recommend them like Jamel Robinson, like that these are artists that they should really embrace and, who are doing amazing things because I really believe in it. I really believe in what they're doing and there's so much more to do. But they're doing it, they're beyond the weeds of it, right? They're really sort of, setting the standard of how we should be integrating art in our systems.
And the mural legacy continues in the community with our community mural projects. Larissa, can you tell us a little bit about that?
And so we have, I think, 50, to the airing of this podcast, I think 52 murals in the collection. And the first 26 were featured in a book called Healing Walls that came out a couple of years ago. And we are in the middle of producing a second, version of that as well that will not only include all of the other murals that we've done since then, but also sort of this thread of conversation around the importance of arts and medicine departments as a public health initiative. And so the community mural program is just really, continues and is wonderful. And it takes a lot of New York-centric artists. We want them to be reflective of the communities that we serve and really be part of the co-design. So we're really, very proud of that.
It's great. And I think since I've did my mural with you, I'm doing like 3 others.
Oh, damn it.
I'm doing one at Help USA, a little competition there. But I think what it does, it allows space for others to do the same, right? And be responsible and take the initiative, and whether it's housing projects or hospitals, like they start to look at this as a model and say, how can we do this over here?
Exactly. And I think when you have someone with Mickalene's notoriety and you have these younger, more emerging community mural artists that are frankly within the same cohort, that's pretty powerful. And I think that, so thank you to you and Derek Adams and so many others that we have now that are, a part of that really help to kind of advance this idea that, the hospitals are a place where everyone, including the public hospital, need to be treated with dignity and equity. And the art certainly reflects that. And I do love to tout that, we have a, more incredible collection than many, as I said earlier, of these more affluent systems because everybody kind of deserves this.
Your department, outside of kind of the visual arts, it also participates in a lot of other kind of, performative arts and music. And I want to highlight one in particular, the Lullaby Project. Can you tell us about that?
So to back up a little bit, the music in general, our sort of umbrella for that is Music for the Soul. And under that, we have several different projects happening, and one of them is our public music concerts that you're very familiar with, I'm sure, that we partner with Sing for Hope. They play all over the place. They do sometimes the night shifts even, which is great. We want to think about those communities as well. The Lullaby Project is an amazing partnership. We do a lot with Carnegie Hall, and they have a wonderful education department there led by Sarah Johnson, who really thinks about how they can extend their resources at Carnegie Hall into the community. And so the Lullaby Project, I think, has been embedded here since maybe 2011, and it pairs a mother with and their newborn with a Carnegie Hall musician, and they create a lullaby that's representative of their culture. It's really amazing, and there is a lot of science on that related to long-term bonding and cultural relevancy and things like that. So that's exciting. And then we did just launch another incredible pilot program with Juilliard Extension that is called Harmonizing for Health, that is bringing different music experiences for 6 months to nursing leadership and non-clinical leadership at Bellevue Hospital. And that's been really interesting. We're almost done with the pilot, but it's been everything from like a sound bath to jazz to hip hop. And, we have the Yale School of Public Health evaluating it for us to help us think about, how is a program like this, A, how can this be sustainable? B, does it work? How did it address burnout? And, you said testimonials, Mickalene, like listening to these nurses like come out of these different sessions. And I was a little worried about the sound bath. I thought, like, are they going to think this is kooky? But,
the sound baths are great.
The sound baths I think they're great.
Yeah.
But they were really, there's a lot of physiology happening here. You're lowering your cortisol and all this. So, they would be like, oh my God, I was so relaxed the rest of the day. I thought, I hope you weren't too relaxed. Like, you need to still. But, they were really learning about this. And so thinking about, again, how those kinds of programs can be expanded and used to support our staff. So music's actually probably one of the most evidence-based sort of forms. But so we love Carnegie Hall. We do a lot with the Brooklyn Museum. Brooklyn and Whitney probably are our two museum partners that really do the art observation called Heart of Medicine. I think have you taken that before? Okay, great. And they've used Mickalene's piece in it multiple times now. So, I think that those are, very important. And then there's a lot of other nonprofits as well. We work very closely with an organization called the Creative Center that helps us with our artist in residencies. So we have 6 sites now that have an artist that's there like once a week, and they do all sorts of things with staff. So it's really cool.
It's incredible. It's so much. I think I've just seen you're keeping us culturally relevant as the hospital. But I've also just seen so many things happen in terms of arts in our system in the last few years. Where do you think we're going to be in the next 5 years?
Well, that's a great question, and I think it's a really important one. And I think we'd like to continue to obviously expand on all the things we've talked about today. But I really very passionately believe that, we need to demonstrate as leaders in the world, because we are this large public hospital, because we are in this incredible city, that this, and because we deal with and serve so many diverse communities, that an arts and medicine strategy embedded within the hospital is a standard of healthcare that should be on the continuum of care everywhere, full stop.
We've gone through so much. This final question is for both of you. What do you hope that patients, families, and staff feel when they walk into a NYC Health and Hospitals space that's shaped by art?
For me, one of the hopes that I have for them is that they feel safe and comforting, that they have this feeling that they belong, that this space is going to provide the care that they need. That's what I hope.
I mean, I would honestly say the exact same thing, that it would enhance trust in us as a system that is there to care for them and, provide all of the different kinds of resources, including access to art and culture, to make them healthy and feel meaning in this life.
Well, that's all the time we have for today. A big thank you to Larissa Trinder and Mickalene Thomas for joining us and for sharing the incredible work behind arts and medicine at NYC Health and Hospitals. Thank you so much. So from mosaics, murals, and world-class art collections to music, exhibitions, and community collaboration, this work reminds us that healthcare isn't just about treating illness. It's also about caring for the whole person and for the communities we serve. Thanks for listening to The Remedy, and don't forget to subscribe where you get your podcasts. Also, we have a Bloomberg Connects app that I encourage you to check out. It has a list of all the different art pieces in our system, and we also have a website for arts and medicine. I'm Michael Shen, and I'll see you next time.
This podcast was produced in partnership with Amaze Media Labs.